Last week's cold and ice definitely caused their share of injuries.
And on top of that, the number of Metro Detroiters with colds and other illnesses, the mix of all of this, keeping local doctors pretty busy. Dr. Frank McGeorge here with this week's rundown of what's going around. Frank.
In the ER at Henry Ford Hospital in Detroit, I've been seeing lots of the same things as prior weeks. To quote one doctor, it is literally the same things. Nothing is changing. That basically translates to lots of coughs, colds, congestion, and fevers. Here's what's going around near you. In Wayne County, Dr. Tiffany Widener at Children's Hospital says RSV, influenza, and other respiratory viruses are circulating, although she does note there may be less COVID. In adult ERs, Dr. Jennifer Stevens-Hoyer at the Plymouth Henry Ford Medical Center says she's seeing influenza and COVID. Trinity Health Livonia reports an increase in slip and fall injuries and injuries from car accidents. Corewell Health Taylor is seeing respiratory infections. Moving to Oakland County, Dr. Steve McGraw at Ascension Providence says he's seeing upper respiratory infections, stomach viruses, strep throat, and pneumonia. He also notes less COVID. Henry Ford Health West Bloomfield and Trinity Health Oakland say respiratory issues and influenza are common. Henry Ford Health Dr. Rena Dazia is seeing the same respiratory infections plus some minor frostbite. Nurse practitioner Sarah Ronner at Corewell Health Troy says respiratory viruses, stomach viruses, and slip and falls are keeping them busy. Looking at Washtenaw County, the health department says confirmed flu cases and hospitalizations are both high. Dr. Brad Uren at University of Michigan Health says most respiratory infections leading to hospitalizations are from the flu. He's also seeing lots of injuries from falls on ice. Heading to Monroe County, ProMedica Monroe Regional is seeing patients with nausea and vomiting as well as influenza. Moving to Macomb County, Dr. Ali Saad at McLaren Macomb reports upper respiratory infections from COVID, the flu, and RSV are steady. Stomach viruses are common, and more slip and falls. Dr. Marissa Samuel at Henry Ford Sterling Heights is seeing more upper respiratory infections, pneumonia from the flu, and stomach viruses. Now, although there's flu everywhere, according to the MDHHS Influenza Activity Report, statewide flu activity continues to decrease over the past 2 weeks. Let's just hope that trend continues. Also, the reports of fewer COVID infections is also good news. Unfortunately, there is still plenty of winter left, and this is no time to let down our guard. The flu and COVID can come back just as easily. Back to you.